Let me welcome all my viewers once again today on the Beyond Sugar live program. As you know, we have been connecting with you on a daily basis and sharing with you information not only to help you understand more about diabetes and its complications, but we also invite for you renowned doctors from across the country who can talk to you as a friend. They can talk to you directly and answer to your questions as well. Beyond Sugar is created in collaboration with RSSDI, which is an apex body of diabetologists in the country, as well as Indian Society of Nephrology, to ensure that you are getting scientifically correct information which can help you manage your disease and learn more about it as well. In the context today, I'm very happy and glad to welcome Dr. Amitabh Soor from the city of Kolkata. Sir, welcome to the show.
Thank you. Thank you.
And before we move forward and start talking about today's topic, which is very interesting, and many of our viewers want to know more about how to take care of feet during the diabetes. And many people have heard about diabetic foot and there are queries related to it. तो आज हम बात करेंगे डायबिटिक फुट के बारे में मगर आपके सवाल लेने से पहले लेट मी वेलकम एंड फॉर्मली इंट्रोड्यूस डॉक्टर अमिताभ. He is one of a very senior consultant endocrinologist in the city of Kolkata and practicing right now in Peerless Hospital. He has multiple publications and papers in various national and international journals as well as chapters in the textbook. So he's very keenly interested in some of the subjects in endocrinology like type 2 diabetes and bone health. And also he's very keenly working in type 2 diabetes and young adults, as well as how does diabetes has impact on the hearing capabilities. So which are very interesting special interests of his. And I'm sure with this record of his academic record, we all can today very comfortably believe him and ask him our questions as well. Sir, let me invite you at this moment for your opening remarks on this topic, and then we will start taking the questions as well.
Thank you. Thank you, Mr. Mehra. Actually, diabetic foot ulcer is a very pertinent topic to discuss about. It's a very common complications which we see in all types of diabetes. It is not just restricted in type 2, but type 1 diabetes and all other forms of diabetes. We see diabetic foot ulcer. This complication is one of the major causes of non-traumatic amputations, which we see in our clinical practice. And also, diabetic foot ulcer not just can lead to amputation, but can also lead to enhanced risk of cardiovascular mortality and death from any other cause also. So therefore, we have to, if the person is living with diabetes, the person has to take proper care of his or her feet so that foot ulcer does not develop, and if at all it develops, then it can receive early treatment and it can be cured of.
Yeah. So thank you very much, sir, for setting the context and sharing your opening remarks and telling us how important it is to look at the foot care in diabetes. But generally, sir, I mean, just to start, this conversation, what can actually go wrong in the feet in a diabetic patients, and why diabetic foot we say is so much of concern, especially in the diabetic patients. Why does it really, can be a difficult situation for the patients?
So for all patients who are living with diabetes, uh, with diabetes your nerves get affected, and that can lead to neuropathy, and that can lead to decreased sensations in your foot. That makes you susceptible to develop small or big traumas without things coming into your knowledge. And therefore, daily food inspection is something which we ask to do for each and every patient. It doesn't take much time also. Daily cleaning of feet is required for each and every patient. If the person does not takes proper care of his or her feet, does not cleans his feet daily, does not inspects his or her feet daily, then if an ulcer develops and if the person does not get to know about it immediately and the treatment does not start immediately, then usually in diabetics the ulcer can uh, get worse very quickly, and healing is also impaired in diabetic patients, and therefore it can cause problems. It can also lead to spreading of infection in the body. It can also sometimes lead to amputation and all. So these are the reasons why adequate foot care is required on daily basis for all diabetic patients.
Yeah. Thank you very much, sir. Sir, although it's a very naive question, but you talked about that sensitivity can reduce, especially in the peripheral, parts of the body because the nerves can get damaged. So why only feet? You use your hands also equally. Does the hands also get equally affected with these kind of ulcers or these problems, or why it is feet when we talk about these things?
Yeah, diabetic hand is also a definite entity. But what happens is, for hand, usually these traumas which remain unnoticed. For feet, it is more relevant. It doesn't happen in hand because hand is closer to eyes and it comes in our notice. Number one, but it's not only this. The neuropathic involvement generally starts in feet, and it is generally more profound in the feet. Also, the vascular insufficiency, which we see in diabetes, particularly the microcirculations, the small arterioles, that means the vessels which are smaller than the arteries, their involvement, the microangiopathy, is more profound in the feet compared to the hands. For all these reasons, the feet are more susceptible to develop ulcer. Also, because of this neuropathy, the foot, it gets constant, it has to take constant pressure. So, a lot of deformities usually come in diabetic patients in their feet. Then these deformities we don't see in hand because hand does not, takes this pressures and all. So, therefore, for all these reasons, diabetic patients they are more likely to develop foot ulcer. And diabetic hand is God, it is an entity, but it is very less common.
All right. So many of your viewers, who must be wondering that why only feet we are talking about. So they are, taking the load of the whole body. They are more in touch, let's say, with the ground and various other things. And of course, feet. हम लोग देखते नहीं हैं उसको बार बार और hands, as the doctor said, we can very closely watch and observe as well if something is going on. So thank you, Dr. Amitabh, for sharing these basic things to start with our viewers. Uh, I want to understand, sir, from you, how common is diabetic foot ulcer in because you will be seeing hundreds of patients in diabetes. How many of your patients may encounter this kind of a problem?
It is actually very common, more common than we usually think about. In fact, there are studies which suggest that up to 30 to 40% of our type 2 diabetic patients develop foot ulcer at some point in their life. Number one. Number two, also, those patients who develop foot ulcer once, they are the one who are at highest risk of developing repeat foot ulcer or a foot ulcer in the opposite feet, to the contrary to the feet which developed ulcer at the previous time. So therefore, it is very common.
Okay. So I think if Dr. Mitab is saying that 30 to 40% of his patients may have at least once in a lifetime kind of a such
Right.
situation. So this is a big number,
It's big
30 to
number.
40%. So which means कि हमें situation के बारे में cautious रहना चाहिए. We should do very important needful things which we will understand more from him as we move forward. Now, so you talked about that people who are at risk, they may have it, and then they may develop it in other field as well. So who are the people with 30-40% who may just be the highest risk people in this to have such kind of a problem?
So, though, see, all type 2 diabetic patients, or for that matter, all diabetic patients can actually develop foot ulcer. The risk of developing foot ulcer increases in those patients who have some or other foot deformity or those who have neuropathy. For people who have neuropathy or vascular involvement in the peripheral arterial disease or both, they are more at risk of developing foot ulcer because, as I said, they will not get the sensation properly, and if they do not inspect their foot daily, then they may develop some trauma which may not come into their notice, and the ulcer grows really very fast. In days, it will grow. So these are the people who are more at risk. Also, for patients who once developed a foot ulcer, for them, healing may be impaired in those patients who have poor glucose control, or who have deranged lipid profile, or who have anemia for that matter, or who have high blood pressure. But then, one thing to clarify, poor diabetes control or high blood pressure or lipids and all, these are related to the healing of the foot ulcer. They are not, they will not put the patient more at risk of foot ulcer. Risk of foot ulcer will be for those who have neuropathy or deformities.
वेरी वेरी इंपॉर्टेंट आई थिंक डॉक्टर अमिताभ ने भी इन दोनों चीज़ों को सेग्रीगेट किया कि there would be a high risk set of patients who may be at risk of getting a diabetic foot ulcer, and then there would be certain situations which may not help in a good healing process of that diabetic. So very important sir, आपने जैसे बताया कि sensation कम हो गई उसको, and इस तरह के patient जो है he would be at the higher risk. So ये diabetes neuropathy कितनी टाइम के बाद सेट इन करनी शुरू करती है सर एक डायबिटिक पेशेंट को? Is it like he has to be
ऐसा है
certified
डायबिटिक
by?
न्यूरोपैथी,
Yeah.
या सो ऐसा है डायबिटिक न्यूरोपैथी किसी को भी हो सकता है, इवन प्री डायबिटीज में भी डायबिटिक न्यूरोपैथी होता है. सो इट इज लाइक दैट. इनफैक्ट डायबिटिक न्यूरोपैथी का ड्यूरेशन ऑफ डायबिटीज के साथ बहुत पुअर कोरिलेशन है. मतलब डायबिटिक न्यूरोपैथी किसी को 1 साल के बाद भी हो सकता है, किसी को बिगिनिंग में भी हो सकता है, किसी को बाद के तरफ भी हो सकता है. और हम लोग जिस न्यूरोपैथी की बात कर रहे हैं उसको अपन सेंसरी मोटर न्यूरोपैथी कहते हैं. हाँ, ये सही है कि जिसको जितने दिन से डायबिटीज होगा उसका चांसेस बढ़ता जाएगा, लेकिन हो किसी को भी सकता है.
All right. So essentially, what he means is that anyone who is having diabetes is at a risk of getting foot ulcer. और ऐसा नहीं कि मतलब it will happen only after 8 to 10 years of diabetes. You have to be careful and watchful from day one, so that you don't hurt yourself with this situation. So now you have talked helped us understand what is diabetic foot, who are the people who are at the highest risk. So now to avoid any such situation, so what are the basic things a patient should be careful about to avoid diabetic foot ulcers or to safeguard himself from this?
So the things which I discussed earlier, just briefly I'm telling, daily inspection of food. This may appear to you very small thing, but it is a big thing actually. Daily cleaning of food, and after you clean your food with soap and water, you need to mop it up properly, dry it up properly, apply some kind of moisturizer like petroleum jelly, coconut oil, anything, whatever is available to you, whatever you can put. And after that, apart from this, what you need to do is you have to wear appropriate footwear. So by appropriate footwear, I don't mean customized footwear. Customized footwear have got some customized typical indication, which we may be discussing later also. But appropriate footwear is important for all diabetic patients. So if you want, I can qualify what is an appropriate footwear
Yeah,
for
please
diabetic
go
patients.
ahead.
Yeah. So for all diabetic patients, appropriate footwear means a footwear which is covered, in which the toes are covered. Number one. Number two, there must be a back support. There has to be a back support. Number three, often we see chappals जिसमें there are partition between the uh, great toe and the other toe. Partition must not be there for diabetic patients. Length of the length of the toe box should be adequate enough to accommodate your longest toe, and from there can be a gap of just one finger or maybe one and a half finger, like that. The depth of the toe box should be adequate enough that your toes can be, you can move your toes comfortably. So these are the important things which you need to note about your appropriate footwear. And another interesting thing is, if you are planning to buy a new footwear, then you have to keep two things in mind. One, you need to buy it in the evening, because for diabetic patients, the shoe size can be a little more in the evening compared to the morning. Number two, for diabetic patients, this is for those who are having diabetes for long duration mainly. If you go to buy it, you may find a very perplexing situation where you will see that your left feet and right feet may be having different numbers. Maybe one is 8, one is 9. It can happen. It may not happen, it may happen. If it does happen, then you have to wear what is the largest. Say 9, so then you have to wear the 9. So these are the things which every diabetic patient, irrespective of what, should keep in mind while selecting the footwear. And of course, the footwear sole should be of a comfortable material.
Yeah. I think very, very important things Dr. Amitabh ने हमें बताई अभी और they may sound small things but very important to take care of your foot. I think just to summarize what he said, first is he's saying about that have a regular inspection of your foot. आप उसको ठीक से उसकी जांच करें, देखें उसको प्रॉपरली क्लीन करें उसको सोप वाटर से और उसको ड्राई अप भी करें, उसको सुखाएं उसको और ऐसे गीला ना छोड़ें और एंड ही ऑल्सो एक्सप्लेन टू अस कि अगर हमें जूते खरीदने हैं अगर या फुटवेयर खरीदना है डायबिटिक पेशेंट के लिए तो वो किस तरीके का होना चाहिए. And just to add on also a couple of things. So if you are wondering how to inspect, so please look in between the fingers of your feet. So कई बार वहाँ पर घाव हो सकता है फिंगर्स के बीच में, हम लोग मिस कर देते हैं. फुट के नीचे अगर आप पाँव के नीचे अगर नहीं देख पा रहे हैं तो एक छोटा सा मे बी मिरर लेके आप उससे देख सकते हैं कि नीचे कुछ दिक्कत तो नहीं हो रही है पाँव. Sir, also please help us understand that what are the things one should look out for कि ये कुछ अर्ली साइन सिम्टम हो सकते हैं फुट अल्सर के. क्या उसको घाव होंगे या कुछ रैशेज होंगे, किस तरह की चीजें किसी पेशेंट को देखने को मिल सकती हैं अनयूजुअल अपने पाँव में जिनको वो अर्ली साइन मान सकते हैं.
एक तो वो ट्रॉमा वाला बात अपन ने बोल ही लिया, अगर कुछ चोट लगा तो वो आपने नोटिस में आ जाएगा. बट अपार्ट फ्रॉम दैट, अगर चोट नहीं भी लगा तो भी देयर इज ए एंटिटी कॉल्ड कैलस. कैलस का मतलब होता है उस जगह में पर्टिकुलरली, जैसे कि आपने बोला फुट के प्लांटर एस्पेक्ट में, मतलब सोल के तरफ ना, कई वक्त जो है एक स्किन जो है वो काफी थिक हो जाता है. ठीक है, वो बेसिकली एक प्री अल्सर है. क्यों? क्योंकि कैलस वाले जो एरिया है वहां पे जब आप पैर को रखते हैं तो होता क्या है, फुट का डायनेमिक्स ऐसे बैठता है कि उस कैलस वाले एरिया में बहुत जबरदस्त प्रेशर पड़ता है. उसके वजह से अगर आपके पैर में कैलस है तो आप समझ लीजिए वो एक टाइम बॉम्ब है, वो एक ना एक समय अल्सर बनना ही बनना है. इसलिए आपको उस कैलस को रिमूव करवाना पड़ेगा, एक डेडिकेटेड जो भी पोडियाट्रिस्ट है उसके हेल्प लेके. ये बात का आपको ध्यान रखना है. इसके अलावा जो आपने कहा टोस के बीच में कई बार फंगल इन्फेक्शन हो सकता है, इंटरट्राई जो कहते हैं हम लोग उसको, तो अगर ऐसा है तो उसको भी हम लोग को ट्रीट करने का जरूरत है. अगर अपार्ट फ्रॉम इंजुरी, अपार्ट फ्रॉम द सिचुएशन रिलेटेड टू इंजुरी, वी हैव टू आल्सो सी द नेल्स. कई वक्त इनग्रोइंग ऑफ नेल्स रहता है, दैट वी नीड टू टेक केयर. एंड ऑल्सो we also need to recognize whether our feet look normal or not. इसका क्या मतलब हुआ? इसका मतलब ये हुआ कि फुट में कोई डिफॉर्मिटी है कि नहीं. कम से कम हम एज ए पेशेंट इतना तो रिकॉग्नाइज कर ही सकते हैं, बाकी तो डॉक्टर को रिकॉग्नाइज करना है. अगर आपको लगता है कि आपका फीट नॉर्मल नहीं दिख रहा, इसका मतलब कि हो सकता है कि उसमें कोई डिफॉर्मिटी है. आप अपने एंडोक्रिनोलॉजिस्ट से मिलिए. कई वक्त हमारे फुट में क्लॉ टो होता है, मतलब देखिए टो ऐसा रहेगा इस तरह. ठीक है, कई वक्त हैमर टो रहता है, मतलब जो ग्रेट टो है वो ऐसा रहेगा. ठीक है, अब इनका सिग्निफिकेंस क्या है आफ्टर ये अगर है तो क्या फर्क ये पड़ता है कि अगर आपका ये क्लॉ टो है, देखिए कई लोगों का ऐसा रहता है डायबिटिक पेशेंट्स का, तो होता क्या है कि आपका ये जो मेटाटार्सल हेड्स है यहाँ पे ज्यादा प्रेशर पड़ता है. तो अगर आपका क्लॉ टो है तो क्या करना है, उसमें ऐसा है कि कोई ओटी वोटी नहीं करना. उसमें करना क्या है, आपको अप्रोप्रिएट फुटवेयर यूज करना है. ये वो वाला अप्रोप्रिएट फुटवेयर नहीं जो मैंने पहले डिस्कस किया. यहाँ पे रोल आता है कस्टमाइज फुटवेयर. सो अगर आपके फुट में कोई डिफॉर्मिटी है, इफ यू हैव सम डिफॉर्मिटी इन योर फीट और यू हैव अ प्रीवियस हिस्ट्री ऑफ either an amputation or a foot ulcer or deformity, then you need to wear customized footwear. How customized footwears are different from what we regularly discuss? They are different because they are made based on your foot structure, और इसीलिए they take care of the pressure dynamics of your foot, and the pressure dynamics of each foot is different from other. आपके दो पैर का प्रेशर डायनेमिक्स भी अलग हो सकता है, इनफैक्ट होता ही अलग. सो वो इन चीजों का ध्यान रखेगा. तो यू हैव टू जस्ट रिकॉग्नाइज अगर डिफॉर्मिटी है तो आप अपने डॉक्टर से मिलिए.
जी, ग्रेट. आई थिंक These are some very, very important points I think he's mentioning, which we all should be careful on. Now, the good thing is that if you are forgetting any such thing, which Dr. Amitabh has just mentioned, you can always go back, rewind this program, see it again, but don't miss out on his small pieces of advice which he's giving. डॉक्टर मिताब आपने बताया जैसे कि कैसे उसको आइडेंटिफाई किया जा सकता है, सो नाउ अब एक जो फर्स्ट रिफ्लेक्स एक्शन होता है कि हमने कुछ घाव देखा या हमने कुछ छोटा सा देखा, कुछ कैलस हो गया, तो वी ट्राई एंड अप्लाई सम मेडिसिन ऑन इट एट होम एंड वी फील दैट कि ये लगाया और अभी ये ठीक हो जाएगा। मगर व्हाट इज योर एडवाइस एज ए डॉक्टर? और हमें जैसे आपने बताया कि कोई पोडियाट्रिस्ट के पास जाना चाहिए, डायबिटिक फूड स्पेशलिस्ट। आई थिंक हमारी generally, in our cities, we don't have specialist people who will work only on diabetic foot or podiatrists. So what should a patient do? Should he go to his treating physician with whom he's taking diabetes treatment? Should he go to a surgeon? क्या करना चाहिए उसको ऐसे में next step?
Actually, the one thing which patient probably should not do is try to remove the callus himself or herself. That is something which is not suggested, because इसमें गड़बड़ हो जा सकता है, और इनग्रोइंग ऑफ नेल को खुद से कर रहा है, ये नहीं करना चाहिए. इट इज नॉट सजेस्टेड एक्चुअली. Now, where to go? Actually, nowadays, usually all endocrinologists, they have podiatrists in their clinic. So you can visit your endocrinologist. They will be having podiatrist, or they will be, even if not having podiatrist in their clinic, they will send you at an appropriate place where this foot care thing is there. At least in big cities, these are now available. Regarding small cities, yes, for small cities, maybe you can visit your surgeon. General surgeon will take care of it. But actually क्या है कि ये छोटी छोटी चीजें हैं, इनमें जनरल सर्जन का इतना रोल होता नहीं है. बट अगर आपके पास ये एंडोक्रिनोलॉजिस्ट या पोडियाट्रिस्ट उनके का लिंक नहीं है, तो फिर आपको जनरल, दे विल डेफिनेटली डू इट, बिकॉज दे कैन इजीली डू इट. बट it doesn't just require that much of thing, no, what I mean to say. But yeah,
Alright.
local physician, I think, may not be much helpful in this.
Yeah. So I think 2-3 things. One is कि अगर ऐसे कुछ घाव हो या कुछ कैलस हो, तो खुद से उसको हटाने का, रिमूव करने का कोशिश ना करें. It can be counterproductive. Now, second is where to go. As Dr. Amitabh mentioned, so most of the good hospitals or endocrine centers, they will have a foot specialist, podiatrist. आप जाएं अपने एंडोक्रिनोलॉजिस्ट से मिलें और वो आपको एडवाइस करेंगे कि व्हाट इज द नेक्स्ट स्टेप. और अगर आप ट्रीटमेंट लेते हैं अपने जनरल फिजिशियन से पास में, तो आप फिर भी आप जाएं, उनसे बात करें, एंड ही विल एडवाइस यू लाइक कि कहाँ पर इस चीज़ का, चाहे सर्जन के पास जाने की ज़रूरत है या किसी फुट केयर स्पेशलिस्ट के पास, वो गाइड करेंगे आपको. मगर उसको पहली बात है कि उसको ठीक से उसको स्क्रीन करके आप उसको मिस ना करें, जांच उसकी ज़रूर करें खुद, और फिर उसको खुद से काटने वाटने की कोशिश ना करें और एक डॉक्टर की एडवाइस लें. ये चीज़ें कुछ बेसिक समझने की हैं. Sir, you also talked about this diabetic footwear, customized footwear. Now, is this customized footwear, is it also available only at the podiatrist and endocrine centers, या फिर ये customized footwear बनाने के लिए patient को क्या करना चाहिए?
The customized footwear is available at many places in big cities now. But ऐसा नहीं है कि ये available नहीं है. But yeah, I agree with you. In small cities, the penetration may not be there. So again, all endocrine centers, like as you said, endocrinologists, they have these customized footwear facility, and even if they don't have, they will just appropriately guide you that where to go, how to do it. But it is available in big cities. It is available.
Yeah.
The question is who needs it. So not everybody requires it. As I said, those who have some deformity or previous history of amputation, or those who have a previous history of foot ulcer, they are the people who require customized footwear. So for all normal type 2 diabetic patient, they can buy appropriate footwear from any good shop. As I mentioned, the criteria of appropriate footwear.
Yeah. So I think very, very important. So wear appropriate footwear. और अगर first time अगर किसी को इस तरह की problem है, you may feel that this is not available or you have not seen it earlier. But as Dr. Amitabh mentioned, these are the things which are readily available. And if you talk to your doctor, he will guide you what to do and how to go about and do it. So now, just on the healing part, I want to ask one question, as you mentioned earlier. So, what is the correlation of the blood sugar levels with the healing or picking up of diabetic foot scenario? So, Is it directly correlated with high blood sugars or controlled blood sugars or no?
So high blood sugars, देखिए high blood sugars can lead to neuropathy. It can lead to the vascular problems, and that can lead to foot ulcer. So that way, high blood sugar is definitely related to foot ulcer development. But then high blood sugar is more to do with healing than to do with development of foot ulcer. So once you develop a foot ulcer, your glucose has to be absolutely normal. Otherwise, the healing will get compromised.
All right. So it's important aspect. So I think there you have to be taking care of your diabetic medicines as well if you want to get a quick heal of your diabetic foot. So finally, asking about some of the questions, like many of our patients who are elderly, they have diabetes. They will be frequently visiting temples, religious places, where they will go barefoot as well, or it is they'll go for the morning walk and walking, barefoot on the grass. How far this is correct, and if not, then what is the solution to this?
See, you should not walk barefoot. First of all, to that's something which you have to be very clear on it. You should not walk barefoot. You should always wear some kind of footwear. Regarding temple, inside temple, तो क्या बोलूं? ये तो बोलना मुश्किल है. But at least कम से कम बाहर से सीढ़ियों पे कम से कम जितना हो सके avoid करना ही better है.
Yeah. All right. So these are some of the practical situations which you may have while your doctor tells you that you don't need to walk barefoot. But आपके पास हो सकता है ऐसी कभी कोई situations आए. So be sensitive to your body, be sensitive to your health, and find out a solution. Even going towards, if you're going to a temple, or so there are things available, wooden sort of जिनको खड़ाव वगैरह बोलते हैं, it's available in the temples. You can be wearing those, or have those socks maybe wearing, so that direct contact with the hot surface, or it can be avoided. But
Right. That's something which has come up of late now.
yeah. So, but very, very important point, I think, as you mentioned, don't try and be barefoot. You may pick up any small thing can hurt your foot, which can be difficult for you. Uh, so I think at this point, what we can say is that I think we have tried and covered the whole topic of diabetic foot for our viewers in a way that you get comprehensive understanding. Uh, if you have any other questions, please do feel free to write back in the chat, and or ask Dr.
One
Mitab
more
as well.
point to add, while
Yeah.
washing your feet, that water should be of normal temperature, not hot, not cold.
All right. Very, very important again. So I think with this we have tried to cover the whole subject for you today, and we're also running out of time. I will thank here Dr. Amitabh for being so kind. He's an expert. He's publishing so many research papers on big things on in various journals. But I think he's been very kind to take on the basic questions today from our viewers' point of view, because those are the things which are very, very important for your day-to-day health. I'll hand it back, sir, to you right now at this moment, if you would like to summarize important things discussed today, or if we have missed out anything, अगर आप उसके बारे में भी अगर कुछ अगर बताना चाहें तो over to you.
So, my concluding remarks will be that diabetic foot is a very important complication. You should take care of your foot daily on daily basis, including cleaning and trying to look for if you have developed some problem. You should, whether it can be callus or whether it can be small trauma, you should urgently report it to your doctor and take proper treatment as the doctor suggests. And side by side, you must maintain your diabetes and you must keep your diabetes in good control, your lipids in good control, your blood pressure in good control, so that even if you develop some ulcer, then also the healing is facilitated.
Okay. So thank you very much with this, Dr. Amitabh, and I must thank all my viewers as well, for all those who joined us today live and watched us, and all those who will later on as well watch this program. अगर आपके फैमिली फ्रेंड्स में या आपके सोशल सर्कल में अगर कोई भी अगर पेशेंट है जो डायबिटिक है, और अगर आपको लगे कि ये इंफॉर्मेशन उसके लिए यूजफुल हो सकती है, you can simply share the link of this program with them, and this conversation can be of extreme help to all of them. So, with this, let me thank all my viewers once again for joining us for this program, And let me thank Dr. Amitabh as well for taking out your time and joining us for this program. Thank you
Thank
very
you.
much, Dr.